From the Brockville General Hospital, I'm talking with the President and CEO, Nick Vlacholias. Nick, welcome to the program.
Thank you for having me back.
Oh, hey, it's our pleasure. So, COVID. Let's deal with this right now. Do you have any COVID patients at the hospital?
Yes, we do. And
shit.
it has fluctuated over the, I would say, 4 or 5 months. And, it hit a high of 10 probably 2-3 weeks ago. And now we're hovering in around 6 or 7 patients.
Those come down a little bit.
They come down a little bit. And, what's really good is Lanark Leeds Grenville has a high vaccination rate. So it does protect individuals. And we're actually seeing the benefits of that right now where, we will get patients.
Yes.
And the majority of the patients that we're seeing that are being admitted to the hospital are over the age of 60. So it's very important for indivials, over 60 years old to get their vaccines.
Yes, and to keep them up, because I've talked to some people who, I've had X number. That's enough. I don't need it. Well, yeah, you do. You do.
I just got mine on Monday. So I would highly recommend everyone to get updated vaccines when they can.
When they're available. The flu. The vaccine for the influenza is now available as well.
Yes.
Have you had any concerns at the hospital with people coming in, the public coming in with the flu?
In fact, we've had a couple of patients that have been admitted to the hospital over the past 4 or 5 weeks that actually have tested positive for influenza A, which is part of the vaccine. So it's very important to also get the flu vaccine. And, prior to COVID, we always would have individuals or patients that come into the hospital be admitted with flu or influenza or RSV. And it's just normal course. And it does happen.
Yes. There's some people that, unfortunately, because of their immune system or whatever they have, it becomes compromised and they end up having to go to the hospital.
Exactly. And we're there to care for them and take care of them and bring them back home safely. Now there's the RSV vaccine also. So highly recommend the RSV vaccine. And there's also the pneumonia vaccine, right? So there's many out there, there's many options. And it's to protect everyone.
Well, it is. Yeah. It's not only to protect yourself, but it's other people that are around you, your families.
That's correct. That's correct.
So are you people masking at the hospital? Like if I was to come and visit someone, would I be masking?
If you're coming to visit somebody, yes, you have to mask when you're going to patient care areas. What we've done is we have a kind of a 2-stage process where if there's patient interactions with staff and patients and clients that come to the hospital, you have to have a mask on, both individuals, both the patients and our staff. If you're in the common areas, walking the hallways in the cafeteria, you don't have to have a mask on. I expect over the next couple of weeks that will change. That will probably be masking right across the board. But we monitor that on a weekly basis.
Oh, yeah.
And when we feel it's the right time, we will probably implement masking across the whole organization.
I can appreciate that, and I can understand why. And our viewers, I'm sure they understand as well that we are going into that flu season because it's getting colder. One thing. Yeah,
exactly. And I remember in just early 2020, I think it was July 2020 when we implemented masking across the organization, because that's essentially was the beginning of COVID or close to the beginning of COVID. And I remember that was a very transformational because people weren't used to wearing masks across the organization, everyone. So masking is one level of protection. It's not the only level.
Oh, heavens, no.
And wearing a mask properly is as important as wearing a mask itself. So.
And you do see, unfortunately, some people, either their mask slips down or they just don't know how to put it on properly. And you're supposed to be covering both your mouth as well as your nose with a mask,
exactly,
right?
Exactly.
Yeah, pull it down so that it is definitely covering. How are the wait times at the hospital?
Well, the wait times, if you're talking about the emergency room, they're much higher. What we're seeing in the emergency room is the number of visits have increased compared to last year. And we monitor that on a regular basis. It's about 2 or 3%. But what's happening is the complexity of visits have gone up quite a bit.
Really?
4 or 5%, just the complexity. So when people come to the ED, we call it is you get triaged based on your symptoms.
Yes.
You get ranked or triaged.
Yeah.
And what we're seeing is that the severity, the complexities is up. So which means that we have to do more tests. It'll take a little bit longer. And we want to make sure that we send you home safely if you have to go home or if you have to be admitted. So there are processes at the hospital that we need to follow. So we're seeing the complexity rising in the ED. Therefore, wait times have risen considerably since last year.
Do we know why?
Well, I mean, one of the reasons is that lack of primary care.
Okay.
If you don't have a primary care physician to see on a regular basis, take care of you on a regular basis, we're seeing individuals coming to the hospital that are sicker than they would be if they had a primary care physician. So that's why it's important for every Ontarian to have a primary care physician. It's going to take some time to get there, but there is a vision by the province to get us there, and hopefully we can expedite that very quickly.
And actually, right now, the hospital's trying to recruit some further medical professionals, are they not?
Yes, we are. I mean, overall, we have about 100 vacancies at the hospital, and that's about a 10% vacancy rate. That's healthcare professionals, not only physicians, but also frontline nurses.
Oh, yes.
And before the pandemic, we were hovering between 3 to 4%. Most hospitals were in around the 3 to 4%. So now we're at around 10%. And this is just, the pandemic has changed quite a bit, the way we live and our thought processes, and basically saying, well, it's time for me to retire. And what we've seen is a mass exodus, not only in healthcare, but across the board, right? And people say, well, it's healthcare, people have left the industry. But to me, when I talk to others, is that other professions happen the same thing. So have been leaving the earth. So we are in recruitment mode. We are working with the city of Brockville on Imagine Brockville Life. Basically, we have a showcase of 12 of our professionals that work at the hospital, physicians, frontline nurses, IT people, and basically saying, in Brockville, you could be at work and then 10 minutes later, you can be on the parkway, or you can be on the river, or you can be hiking, and it's a beautiful area to come. And we are advertising downtown Toronto, and we're also advertising downtown Ottawa. So we're hopeful that our recruitment strategies will work. We're also going to be working with the United Counties of Leeds-Grenville on some initiatives around physician recruiting. So we're doing what we can, but it's highly competitive out there, very competitive.
Oh, yeah, but at Brockville, Brockville, come on.
It's a beautiful town. It's a beautiful area. And obviously we're showcasing the Thousand Islands corridor. And we have a gem here, and we just need to showcase it a bit.
Yes. Get the right person and they'll be along.
Yes.
They'll be along. Can you explain to me, what is a pocket health patient sharing? What is that? Do you know what that is? I saw that somewhere.
I don't know exactly what it is. It's probably information on your health.
That's what I wonder.
That's online.
Okay.
So what's happening here in Ontario is that a lot of hospitals are moving towards new health information systems. And we are here in Brockville working with the other 5 hospitals in the southeast, which is Perth-Smith Falls, Kingston Health Sciences Center, Providence, Napanee Hospital, and Quinte in the Belleville area of the 4 sites. We are going to have one system for one healthcare system, information system. That way we can have sharing of information across the board and have standardization on the way we do things. And at that time, it's supposed to go live sometime late next year, we will have what's called a portal. And patients can go to the portal to see their information. It's their information, and it should be available to them. And one way of doing it is doing it through this transformation, as we're calling it, on using a modern health information system amongst the 6 hospitals.
So would this be something if I had, say, an X-ray, some imaging done on my hand, would I be able to go in and actually see that image?
I'm not sure about the image, but you'll be able to see the report.
Oh, okay. Okay.
And it basically, you'll have the information probably a couple days after the physicians would see it. If you have a primary care physician, there is a slight delay just to ensure that information gets to the physician
to
first.
where it's supposed to go, yes.
And it is quite innovative. United States has done this for almost 10, 15 years. They're way ahead of us on this, and Ontario's catching up. So we are.
Well, actually, what they've done is they've taken the bugs out, all the bugs and everything. So now,
I like that.
Yeah.
I
So
like
we're
that. Yes.
Now we're going to investigate and bring it on board. Let's talk about the MRI. This is so exciting for the hospital.
Very exciting for the community.
What's it going to mean to the doctors?
Well, I mean, they don't have to send referrals to Kingston, Ottawa, Cornwall, so patients can stay here in Brockville and get what the services they need here.
And they won't have to wait for the information to come from another hospital, right?
Exactly.
Wow.
It's now state of the art. It's taken us a little bit longer to mobilize the MRI because we need to actually do a new addition. Is that we didn't have existing space, so we have to put an addition onto the hospital, which is going to be adjacent to the main entrance, the new main entrance in that courtyard, which is west of the courtyard. As soon as you come up around the circle,
yes,
and it'll be off to your right, where the flagpoles are.
Okay, all
exactly.
right, that's good. Yeah. Good marker. Nick, thank you for coming in today, sitting down with me. I really appreciate it. Is there anything else that you would like our viewers to know as to what is happening at our local hospital?
I would just like to say thank you to the community for the support of our staff and being patient with us. It is a tremendous community, and I've seen this over the 6 or 7 years I've been here. It is a great community, and it's in the support of the hospital and our staff. And our volunteers and even the fundraising is just incredible. So a big thank you to everyone.
Thank you.